Good afternoon, Annette Rodriguez, Health Director. I'm going to start out by introducing our county judge, Barbara Canales, and she's going to be here via WebEx, so she will give her presentation first, and then I will follow with the Nueces County COVID-19 statistics. Thank you.
Well, good afternoon, everyone. Barbara Canales, Nueces County Judge, and I hope you had a wonderful holiday. We are back at work in Nueces County Courthouse, and we have a really great message to share with you today. As we approach a new year, it is very clear to me that that new year comes with new hope. Today, in Nueces County at the Richard Borchert Fairgrounds, we vaccinated over 500 people in the first phase, which we call the Tier 1A phase from the state of Texas directive on vaccine management. We are very proud of the fact that we have over 12,000 vaccines here in Nueces County, and our goal is to use every single one of them and get more as quickly as we can. I want to make sure that everybody understands that we are working on a directive from the state. The Tier 1A, which is the first phase of vaccination, is really focused on very specific folks. These are folks that are involved with the direct testing, vaccination, or healthcare treatment of COVID-19 patients. So that means there's a lot of doctors, nurses, occupational therapists, respiratory therapists, and all the support staff at our hospitals that are being vaccinated right now, including outpatient services. In addition, our residents that are living in assisted living facilities are also being targeted for the vaccine right now. In addition, any emergency operation folks that are directly involved with vaccination or testing are also receiving the vaccine. And we are doing this through a variety of providers, from hospitals and small clinics to Nueces County Fairgrounds, where we have our city county health department administering the vaccine, all the way to our Corpus Christi Fire Department. This is an amazing effort, and I could not be more proud to tell you that this new hope occurred for the first time on Christmas Day. And shortly, I'd like to share with you a short video that really tells the story of how efficient and how excellent our protocols are in administering this vaccine. Very shortly, we are going to be in the next phase, which is 1B. In that phase, we're going to ask for your help, because that phase focuses on those folks that are 65 years and older and would like to get the vaccine. We're going to direct you to our nuecesknows.com, nuecesknows, Knows.com, and there will be a link at the appropriate time in order to get your vaccine. It's happening a lot quicker than I think any of us really imagined. And I believe that in January, we're going to be vaccinating our very much larger populations. And so be patient, because hope is on its way. Let's look at the video so that you can see hope in action. So you can see why I say with great pride that we are over the moon about the pride that we feel for our Nueces County, City County Health Department, staff, and all of the folks from logistics, from the city of Robstown and all of their emergency management team, to the city of Corpus Christi, as I said, to our own Nueces County staff. Our emergency management is really just an amazing machine to watch in action. And so let's ring in the new year with a renewed optimism that we can see that light at the end of the tunnel.
La juez quiso dar un mensaje a la comunidad. El día de hoy en el centro de exposición logramos vacunar alrededor de 500 personas. Actualmente contamos con 12,000 vacunas. Continuamos vacunando a las personas de la etapa 1A, que son aquellos trabajadores de salud quienes están en mayor riesgo de contraer el virus debido a su trabajo directo con pacientes positivos al virus. Posteriormente vamos a llevar a cabo el nivel 1B, en donde podremos vacunar a mayores de 65 años. Tendremos un registro en el portal nuecesknows.com. Ahí encontrará información para registrarse una vez que esté disponible. Estoy orgullosa de todo el trabajo que se está realizando a la ciudad de Robstown, a la ciudad de Corpus Christi y el condado de Nueces. Viendo hacia el 2021, espero poder vacunar a la población en general pronto, ya que todo se está ocurriendo más rápido de lo que esperábamos.
Thank you. So we're going to go ahead and start with the Nueces County statistics. First slide, please. So this slide actually shows a bar graph over the last 2 weeks, and if you'll look, this is not good. So we just passed the Christmas holiday, and so we see the cases started going above 150, and now we're at 191 today. That number should make everybody nervous and should remind us all that we're not out of the woods yet. Next slide, please. And this donut diagram basically shows 26,267 people have recovered. I hope everybody's hearing these numbers. These are huge numbers. Nueces County has a total of 28,953 COVID cases. Active cases, there's still 2,100 people that have active COVID-19 currently, and we've had 544 individuals who we've lost this year alone to COVID-19, making COVID the third leading cause of death in Nueces County. Next slide. The hospitalizations continue to increase as well, and we know that there's a lag from infection time to the time you see hospitalizations. It's gone up, so you can see it very clearly going higher and higher. It's at 168. The hospitalizations, patients with COVID-19 currently here in Nueces County. Next slide. The ICU patients has kind of been staying, plateau, if you will, between 40 and 50 every day in the ICU with COVID-19, that some of these individuals, sometimes up to half of the individuals that you see on these charts, are having to be put on ventilators, and some will not make it. Next slide, please. So a total of 544 people that we've lost to COVID-19. Today, 2 more people lost their lives to COVID-19, and our sincerest condolences do go out to those family members. And then the final slide that actually shows the number of fatalities over time, and you can see 1 day, and then you can see no days, 2, 4, 2, 5, 3, 1, 2, 5 deaths in 1 day, no deaths reported, and then 2 deaths. So we really need to be vigilant. We know that there's therapeutics, but we also know that vaccine has arrived, and so I'm going to talk a little bit about the vaccine. So this morning, right around 10:30 this morning, the Health District received 500 Moderna COVID-19 vaccines. The arrival of the vaccine prompted our immediate vaccine distribution response plan. As such, the Health District coordinated 2 separate events. So I'm going to talk about each one of those. So one effort was to set up our vaccine clinic at the Richard Borchard Fairgrounds via a drive-through. The clinic provided vaccines to all the individuals who are part of the Phase 1, Tier 1, Tier 2, like the judge mentioned. This is the Phase 1, so we set it up initially to take care of all of those individuals that have not been taken care of by the hospitals or by other means. It could be somebody that's in between positions, a nurse that just worked at one hospital now is moving to another hospital, needs to get vaccinated, they can come through our drive-through. The process, and then we also switched over to saying, as the cars started to dwindle down, we said we were going to also look at beginning phase 1B, which is the next slide. And this consists of two areas. One's over the age of 65, and it's also over the age of 16 with comorbidities. And so we just looked at the ones over the age 65 because those are the more vulnerable population and because we have such limited vaccine at this time. The process to receive the vaccine consisted of registering on site. We had about 10 individuals registering individuals that drove through our drive-through. Once you finished the process of registration, you were provided with a unique QR code. The QR code was then presented to vaccinators who would then administer the vaccine. Upon receiving the vaccine, you were then asked to wait 15 minutes so we could monitor to make sure that you had no adverse effects. Our EMS services from Robstown Fire Department were on standby to aid anyone who would develop immediate adverse effects. All you had to do is honk or turn on your emergency lights to get their attention. For those individuals, there are some that are known to have allergic reactions. We actually ask them to wait the 30 minutes. Or individuals that carry an EpiPen with them, we ask them to wait the 30 minutes. Once you received your vaccine, a card was provided to you. Our system will send you a reminder of when your next dose will be and at the time for you to come back, and then you start the process all over again. We had a lot of individuals, like the judge said, when I left a few minutes ago, we were nearing the 500 doses that we had received, and so we were very excited about that. I want to thank the community for their patience, because we were trying to kind of move things around to make it more efficient, and so it may not have seemed that way initially, but we're getting there. The second effort that we had was coordinating with some of our community health partners, our healthcare centers to vaccinate staff, as well as residents who live at these long-term care facilities. So our priority to quickly vaccinate is to ensure that we continue receiving more vaccines from the state. We received a lot of calls today regarding the vaccine distribution clinic. I can assure you that we are doing everything possible to move through these phases as quickly and as efficiently as possible so that we can mitigate the spread of COVID-19 here in Nueces County. We have not yet received any news of when or how much more vaccines we will be receiving. We were told by the state that the first week in January 2021 would probably bring us much larger doses amounts. COVID-19 testing continues to be provided in Nueces County. A list of current sites is updated weekly and is published on the cctexas.com/coronavirus. Please refer to that webpage for more information or call our COVID-19 hotline at 826-7200, option 2. And as always, stay well and stay informed. Thank you.
En las últimas 24 horas se han reportado 191 casos confirmados por el coronavirus. 26,267 pacientes se han recuperado por completo. 168 continúan en el hospital. 47 están en la unidad de cuidados intensivos. 2,100 son casos aún activos. El día de hoy se reportan 2 fallecimientos. A la fecha, los fallecimientos totalizan 544 personas. Por favor, continúe tomando todas las medidas de salubridad, ya que las cifras continúan aumentando y estamos haciendo todo lo posible por lograr la vacunación a la población general, siguiendo las recomendaciones y procesos de los Centros de Control de Enfermedades. El día de hoy, el Distrito de Salud recibió 500 vacunas Moderna contra el COVID-19. La llegada de las vacunas hizo que continuemos con su distribución inmediata en 2 esfuerzos por separado. El día de hoy se llevó a cabo la fase 1 para vacunar a ese grupo, los médicos y trabajadores de salud. Una vez terminada la vacunación, continúa la fase 1B, que consiste en vacunar a personas mayores de 65 años. El segundo esfuerzo incluyó la coordinación con algunos centros de atención médica domiciliaria para vacunar al personal y a los residentes que viven en esas instalaciones de atención a largo plazo. Estamos haciendo todo lo posible para avanzar por las fases de la manera más rápida y eficiente posible para que podamos contener el COVID-19. No contamos aún con información del número de vacunas que vamos a recibir, pero en cuanto las recibamos, el Distrito de Salud estará listo para distribuirlas. Las pruebas del COVID-19 continúan realizándose en el condado de Nueces. Una lista de los sitios se actualiza semanalmente y se publica en la dirección www.cctexas.com/coronavirus. Consulte esa página web para obtener más información o llame a nuestra línea directa COVID-19 al 361-826-7200, opción número 2.
Thank you. That concludes our press conference. Are there any questions? No. Thank you for being here with us, and we will see you next Tuesday. Happy New Year to everyone.